Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. Happy New Year, and I hope that those who are celebrating had an enjoyable holiday season with family and friends. Of course, as we expected, the gatherings that many of us have enjoyed have led to an increase in COVID-19 in the community. The wastewater COVID-19 signal provincially and in York Region is certainly on an upward trajectory, and hospitalizations remain persistently and stubbornly high. Every COVID hospitalization, whether it's with COVID or for COVID, could be less severe or avoided. As I'm sure you've heard, a concerning new variant, XBB 1.5, has been identified and is now causing well over 50% of cases in the US and was recently detected in British Columbia. It's only a matter of time until it is here in Ontario. It has increased ability to evade some immunity and a bit more ability to attach to lung cells, meaning that it's outcompeting other sublineages and is likely to cause a surge in cases, hospitalizations, and potentially deaths in the coming weeks. Between September and the end of 2022, there were over 5 COVID deaths every single week in York Region residents. We know that these were preventable, with a disproportionate number of people not being vaccinated or being incompletely vaccinated. That is, they hadn't been vaccinated within the last 6 months and didn't have the bivalent vaccine. The bivalent vaccine, available since September, is the vaccine that prevents against Omicron. The previous vaccines do not provide the same protection. So if you had 2, 3, or even 4 vaccines, but not the bivalent vaccines, you are not as protected as you could be. Please do visit one of our clinics to get it. I have mine and everyone should have theirs. Just over 40% of those over age 70 have had the bivalent vaccine in York Region, but all of us should have it. You may still get COVID, but you're far less likely to get severely ill or be hospitalized or die if you've been vaccinated with the bivalent vaccine. Over 200,000 York Region residents have a bivalent dose. It's time to get yours. Even if you had COVID, if your infection was over 3 months ago and you haven't had the bivalent vaccine, please visit one of our clinics or your nearest pharmacy. You can also receive your annual flu shot at the same time. It's not too late. Visit york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675 to find a clinic near you. You can book ahead or walk in for either or both vaccines. We've maintained our clinic capacity to be sure that you can easily and conveniently access the vaccines you need when you need them. We have seen vaccine coverage in the province and in York Region stall in the most high-risk neighborhoods. Many of these neighborhoods had higher case counts, hospitalizations, and deaths throughout the pandemic. We need to redouble our efforts in these areas. It may be time to kindly inform or encourage your friends and loved ones, no matter what neighborhood they live in, to get vaccinated, particularly those over age 70, but also those of any age. You could make a difference in your community. Of course, it's not only COVID-19 that continues to overwhelm our acute care hospitals. Fortunately, influenza cases have declined somewhat recently, but RSV remains a significant threat to children. I have recently seen several young children with RSV who needed intensive care. Watching a baby struggle to breathe is heartbreaking and it's preventable. Following our busy holiday season of gatherings, let's all do our part to prevent additional spread of all of these circulating viruses. Please monitor yourself and loved ones for any cold or flu-like symptoms. Should you have any symptoms, please remain home from school or work. If you do have to go out, follow all other layers of protection. Practice good hand hygiene, remain distant whenever possible, and wear a mask when you have symptoms, and ideally for 10 days after your symptoms began. While masks are not mandatory in many public places, it remains your best protection to have one with you in case you find yourself in a crowded place or in close contact with someone, particularly someone who's vulnerable. Recent polling data shows that well over half of Canadians and Ontarians support masking, and most are doing so some or much of the time. This is great news and continues to show the respect we have for each other, and it really does make a difference. What may be a mild cold for one person could turn into a severe respiratory infection for someone else more vulnerable, especially those over age 70 or those under age 4. Many schools will be reopening this week after a holiday closure, so please be cautious and do what you can to protect those around you. Let's aim to prevent a surge to the degree possible this winter. Please do get vaccinated with the bivalent vaccine as soon as you can. We can all hope that this new year brings good health to all, and please continue to be safe, thoughtful, and kind.